Good evening, friends. So, today we are talking on stress. Some of you may remember I had said we'll talk on a clinical topic, but then we did an analysis of 100 prescriptions of family physicians, general practitioners, and specialists, all specialties. And around 85% of them, for varied ailments, had a co-prescription of either alprazolam, escitalopram, amitriptyline, etc., etc., etc. So again, some research showed this was a research done in primary care, that is the general practice. Review of audio tapes of primary care practice of patients with chronic disease. 439 interactions with 49 doctors were reviewed. Stress was by far the most time-consuming topic. Patient may have presented with a low backache, a headache, a palpitation, a neck stiffness, or recurrent diarrhea not responding to treatment, or polyuria with ultrasound normal. Nearly 60% of the discussions were not perfunctory, like not just passing, but attempts to counsel or encourage behavior change in the patient. It was not just discussion of stress in passing, but the doctor actually tried to tell the patient to change their behavior. It has been estimated that 70 to 80% of primary care visits, our patients who come to us, other than high fevers or acute diarrheas, involve an illness that is caused or augmented by stress. So this is an all-pervading problem in our practice, and it is time that we address it well, because competition is increasing and we have to be better than the doctor next to us. And if we don't talk to the patient about behavior change, then it's going to be a tough task. Just 1 second. I'm getting a call. I'll just tell you. Abhay, I'm taking a lecture. I'll call you back. Okay. So what is stress? Stress could be emotional. You have been promised a promotion in the company and you do not get. You propose to someone and you were denied. It could be environmental. I am a practitioner and I have told my wife that I will pick her up at 9 o'clock and we'll go for night show movie. And at 8:45, I have 10 patients waiting in my clinic. My environment has suddenly become stressful. Or it could be physiological, fear or anger, which could become emotional also. Stress is a condition or feeling experienced when a person perceives that demands on him or her exceed their personal as well as social resources that we are able to mobilize. We in India are fortunate that we have a social infrastructure. People in Western world have nil social infrastructure. Here, if you go for a visit and an old man and woman are alone, you can always trust that somebody in the building will take them to the hospital if required. So if a person feels that what he or she is supposed to do now cannot be done by him or her, plus whatever social support they enjoy, and that is the situation of stress. So you have a smoker, you have been telling him to give up smoking. He says, doctor, I cannot think, I cannot attend meetings if I don't smoke. The day you see leukoplegia and you advise a biopsy and you say now is the time that you have to give up smoking, and it may be already too late, he is forced to give up. And when he's forced to give up, that gives him stress because he's not able to cope up with the change that is expected on him. Stress is not what happens to us. The cause of stress is not important. How we react or respond to what happens is very important. I'll give you 3 instances. You are walking alone in the night and the lane has no light and you hear footsteps behind you, whether you are carrying cash or not. You stop, the footstep stops, and you are sure you're not imagining. You get tense, you get scared, and you start feeling a thumping in your chest. You have beads of perspiration on your forehead, and you have an empty feeling in the pit of your stomach. That is stress. A person has been called by the boss for a meeting and he's waiting outside the boss's room and he could hear boss shouting at some other employee. He knows boss is in foul mood. He gets scared of losing the job. So he gets the same feeling, palpitation, beads of perspiration on forehead, and empty feeling in the pit of the stomach. And thirdly, one of us who attended to a patient last night and sent him home with antacids, and the patient died in the night, and now the relatives have come wanting to talk to you. Till they come in, are they going to be civilized conversation? Is it going to be angry? Is it going to be accusation? You get palpitations, beads of perspiration on your forehead, and an empty feeling in the middle of the chest or epigastrium. All 3 causes were different, but reaction was same. So stress is not the cause, but what the physiological changes that come in us. And 2 of the most common emotions are anger and fear. Stress is defined as an environmental condition that require behavior adjustment. If I'm walking alone and I have a fear of somebody attacking me, I have to be prepared to run or to fight. And that is my behavior or environment changing, behavior adjustment. If my boss fires at me or shouts at me, I have to change my behavior by accepting that gracefully and trying to explain in a cool voice. And when the patient is waiting out, the relatives, I have to change my behavior. I can't be arguing that my decision was right. I have to think what I'm going to talk if there is accusation. Thus, change, good or bad, can induce a stress response. You will say, why good change? I'll show you a list of 100 top stressors. Suddenly, you are told you have a marriageable daughter or a son, and suddenly their marriage is fixed, and the opposing party says, I want the marriage in a week's time. It's a good thing that is happening, but that will give you a stress. How to arrange in a week? I had arranged for money, but then it takes time to mobilize the money. So good things also give stress. What are the common stressors? Death of spouse on a scale of 100. Divorce, jail. These are American statistics. In India, jail is not so common. Death of close family member or death of a close friend. Marriage, which is a good, red ones are good incidences, but still give stress. Fired at work. Retirement. Retirement is very stressful. We never retire. People who worked in municipal corporation or government retired, but then they had an option of continuing practice. People who retire actually undergo a lot of stress. It's a total behavior adjustment for them. Every morning, get up at 7, get ready, leave at 9, come back at 5 or 6 or 7, and ask your spouse, so what did you do the whole day? And suddenly you have nowhere to go. In my practice, we have had 2 divorces when the man retired and the wife couldn't take his irritability anymore. So everything, retirement, somebody may think is a good thing, but no, it's a big stressor. Gain of a new family member, a birth in the family, or a marriage, a daughter-in-law coming home. Large loan or mortgage, especially when your practice is down, difficult to pay EMI. Trouble with boss. Fortunately, we don't deal with that unless you're working in hospitals or BMC or government. Change in residence. Shifting residence is generally for a better house, but then that is stressful. The whole rigmarole of shifting is stressful. Any vacation. Today, even if you are going for a vacation with a tour operator, it is a stress. Diwali, Christmas also is a stress. And minor violations of law, if you are breaking a signal and if you are caught by RTO, till you manage that, there will be stress. The research didn't control or include practice-related stress. COVID practice stopped. After COVID, practice has never gone back to pre-COVID times. People have financial liabilities. Patients not getting better, patients accusing, patients leaving you, all that is stress. Stress is not new. From the primitive ages, the acute stress response was essential to survival in a time when human beings faced with many physical threats, animals, pirates, and other things. People running away, whether it was animals, pirates, or it was bad weather. Like now in Chennai, people who were affected by the floods must have gone through major stress. Stresses of modern life are more likely to be chronic and often psychological and interpersonal. They're very rarely physical. End-stage cancer, although the cancer is a physical disease, the stress is psychological. Or interpersonal, marital disharmony. Today, if you see, most mothers are unhappy with their children in 10 to 12-year age, and children are equally unhappy with parents. Unfortunately, even though the stressors are psychological, the body still reacts as it was a physical threat. As I said, whatever the cause, the results are the same. What are the major pathways? Now see, there's a stressor. Our mind perceives all the three situations that I described. Walking on the road in the night, waiting outside the boss's room, or your compounder telling me, sir, relatives of that last night's patient have come. How does the body respond? The signal is picked up by nervous system. Then it involves endocrine system. And then our immune system. We'll see how all this goes on. And optimally, in a normal status, interaction of these systems maintains homeostasis and wellness. If all these three are in perfect harmony, then we are well and we are harmonious. There is a balance. Parasympathetic system is giving a feeling of rest and restoration, and sympathetic system is giving a feeling of fight or run. Flight or fight is a major theory of stress management. Sympathetic nervous system, all that we described, palpitation, sweating, empty feeling in the pit of the stomach, are all sympathetic system related. Sympathetic system integrates the fight or flight response. It releases noradrenaline and adrenaline. And this increases the heart rate and blood pressure. So my feeling of palpitation is because of a release of adrenaline, noradrenaline. Increase respiratory rate and bronchial dilation. So I will also feel shallowness of breath. Increase glycogen to glucose in liver. Glycogen gets converted to glucose to supply more energy. If I'm going to fight or if I'm going to run, I need energy. So the body is preparing glycogenolysis, converting glycogen to glucose in the liver. Pupil diameter increases. What happens in fear? The pupils dilate and decrease GI activity. Now, we have the whole body. Stomach is like a concrete mixer working 24/7 by 365 because it has to digest whatever trash we eat. Now, when energy is wanted at the periphery to either fight or run, energy is diverted from the stomach to rest of the body, and an empty feeling in the pit of the stomach is because stomach slows down. I'll explain this. This is the human body. I may have shown this about 2 years back. Some of you may remember, but I am repeating it. And we have a heart which is very comfortably beating at 60 to 90 per minute. And then when we are stressed, adrenaline, it goes up to 120, 150, 160. Our BP, which is normally 120, 80, when we are angry or scared, it may also go up to 200 plus. Our blood glucose goes up because we need energy to fight or run. And for both fighting and running, we need muscles. So we brace ourselves, and that gives a feeling of muscle tension. When it is chronic, it may lead to stiffness of neck muscles or back muscles. Our respiration becomes shallow, and our stomach, which is working fast, suddenly slows down, and our pupils dilate. Now, when all this is happening now, this, friends, is stress. Whatever the cause, the feeling is the same: palpitation, shallow breathing, pupils dilated, emptiness in the pit of the stomach, and maybe muscular tension. This is fight and flight. See, all these people are running with the fear of bulls. All of them must be getting all this energy, the heart pumping, glycogen converted to glucose, all this happening. But this response dissipates quickly. The minute the stressor goes down, people come back to normal. So we saw what sympathetic system can do. Let's see what parasympathetic system can do. Integrates the rest and recreation, feed and breed response, not fight and flight, feed and breed. Also known as rest and restoration or rest and relaxation. Release of acetylcholine, decrease heart rate and blood pressure, decrease respiratory rate and decrease bronchial constriction, reduce bronchial dilation, decrease glycogen to glucose conversion in liver, and pupillary constriction, exact reverse of what sympathetic system was doing. And increase GI activity because all the energy is now coming back to stomach. So, as I said, stimuli received by the brain through one or more of five senses. You can hear, you can see, you can perceive. It could be a touch. You are standing in the dark, waiting who's coming behind you, and suddenly you feel a crawling up your ankle. Touch. All five senses, anything can give you a stimulus. Brain deciphers the stimuli as a threat or non-threat, and body stays aroused till the threat is over. Body returns to normal. So body stays aroused, sympathetic system, until the threat is over, and then body returns to homeostasis, parasympathetic system, when the threat is gone. Again, explaining, this is our brain, cerebral cortex. This is a stimulus. And the reaction time is seconds or fraction of a second. Brain perceives a stress stimulus and immediately acts through reticular activating system on the hypothalamus. The stimulus may directly stimulate the hypothalamus also. Hypothalamus sends signals through corticotropin releasing factor and through thyrotropin releasing factor to pituitary. Hypothalamus also through sympathetic nervous system affect adrenals. Pituitary also affect the adrenals through ACTH. Pituitary, in addition, at the same time, through thyrotropin releasing factor, affects the thyroid. Thyroid hormone thyroxine leads to physiological arousal. ACTH working on adrenal gives rise to cortisol, aldosterone, adrenaline, noradrenaline, leading to physiological arousal, and then tachycardia, hypertension, all that start. Symptoms of stress are hypothalamus activates adrenal gland to release adrenaline and cortisol into circulation. Adrenal glands secrete more adrenaline. When adrenaline comes in circulation, blood supply to muscles increase. Sweat glands produce more sweat. You have perspiration on your forehead, but your body cools because you are sweating more. Heart rate increases, pupils dilate, rate of breathing increases, shortness of breath. All these are symptoms of stress, and now you know how it occurs. Symptoms of fight or flight: increase heart rate, increase blood pressure, increase ventilation, vasodilation of arteries to body's periphery, arms and legs, feeling of coolness of the peripheries, and increase serum glucose levels. Now, friends, acute stress, short-term stress is okay, but if this stress continues for long period or is recurrent, then this patient will have resting tachycardia, will have hypertension, will have hyperglycemia, will have breathing issues, and it has feeling of cooling or a feeling of funny feeling all over the body. It also leads to increased free fatty acid mobilization. So chronic stress leads to high triglycerides. Muscles will get increased strength because you are in a constant position of bracing. I have to run, I have to fight. Stomach movements get slow, and that causes hyperacidity. When the stomach content do not pass into the duodenum at a 2 to 3 hour interval, then the acid remains there, symptoms of acidity and GRD. Increased perspiration to cool body core temperature, people start feeling chilly, and dilatation of pupils. There are two types of stress. One is eustress, one is distress. Eustress, as you know, is normal. Euthyroidism, euglycemic. Eustress is good, distress is bad. So one stage is no stress. This is a bored person. Anybody tells you no, I have no stress, is either lying or is coming from Himalayas, because everybody has stress. This fellow also is bored. He may not have stress, he may not have fight or flight thing, but he doesn't know what to do with his life. Eustress is positive stress. The feeling that you get when you're sitting on a giant wheel, and when it's coming down, it motivates, it excites, it energizes. It is the feeling when you have diagnosed a tough case, which came to you after running around with 3 specialists. Accelerating experiences, type of stress you're likely to experience when one receives an unexpected promotion or reward. We received news that our critical patient reached hospital in time. I did a lot of rushing, I did a lot of activity, a lot of coordination, arranged an ambulance and sent the patient to hospital with acute MI. And when I get the news that patient reached alive and is being treated, I get eustress. Our diagnosis was correct. I insisted on that being the diagnosis, although consultants didn't agree, but I was proven right. I'll give you a case. Long time back, I'm not saying that I am a very good doctor, but I am saying that how it can give you good stress. A 3-month-old baby was brought to me by uncontrolled vomiting. And on the examination, I found neck stiffness. Now, 3-month-old baby to find neck stiffness, but I was pretty sure, and the parents believed me. Their pediatrician was at Bhati Hospital, Tardev. I am in Kalina. They took the baby there. The pediatrician first said, I don't think there is stiffness, but let's wait, since your doctor has so confidently written a note to me. Next morning, the pediatrician said, yes, there is stiffness. They did a lumbar puncture. It was meningitis. When I heard that, it was feeling of good that my diagnosis was correct. And when that pediatrician sent me a letter thanking me for the diagnosis, that was a wonderful eustress. Stress of winning and achieving something. Distress is negative stress, crushes, oppresses, unusual events carried beyond rational limits. Somebody in your family is suffering from COVID and after 15 days still is on ventilator. That is tremendous distress. Negative stress results from losing, failing, not being able to cope. I have been told that I am getting into liver cirrhosis, but I can't give up alcohol. I am attracted to alcohol. I am into tremendous distress because I know what is wrong for me, but I am still forced to do that. And distress affects people in a harmful way. Chronic stress is bad. Somebody may tell me, if you don't give me 2 crores in a week, I'll kill you. I said, kill me. I'll never be able to give you 2 crores in a week. But chronic stress, which occurs every day, is bad, and overwhelming stress is worse. Overwhelming stress, which, suddenly you realize that 2 people in your family have got terminal ailments. Whatever big the family may be, that stress will be overwhelming. So this is the stress response curve. This is good stress. It's a comfort zone. It makes us perform well. It's like, most people, most students before an exam are walking to and fro outside the exam hall. They're using up stress products. People before an interview keep walking, they don't sit. They're using stress products because they have to perform well inside. So all this is good stress, but there is a level at which your performance is best. Beyond that, the stress reduces. Stress continues, it leads to exhaustion, ill health, and nervous breakdown. And this is the curve that shows distress and good stress. Eustress increases performance and distress reduces performance. Then what endocrine changes occur? Just to recapitulate, you may not remember everything. Increase cortisol, increase catecholamines, increase fatty acids. So that overstimulation, increase blood sugar, increase insulin, hyperglycemia and hyperinsulinemia. Increase LDL cholesterol, lower HDL cholesterol. It changes our cardiovascular system, affect the GI system, affect the muscular system, skin, and immune system. What happens in cardiovascular changes? Increase heart rate. We have seen why. I'm just listing them. Increase blood volume or blood pressure. Constriction of certain blood vessels. Dilation of coronary arteries. Increase force of heart contraction. And that gives hypertension. Increase blood glucose, increase free fatty acid, triglyceride, increase cholesterol, high LDL. GI, decrease saliva, feeling of dry mouth. People who come to you with dry mouth and on oral examination, there is no glossitis, no stomatitis, nothing. Your first question should be, what is the stress? Contraction of esophagus, difficult motility, difficulty in swallowing, dysphagia. Increase hydrochloric acid because stomach slows down. Changing in peristalsis, normal movement of the gut doesn't occur. So you either get IBS or you get constipation. Other changes, skeletal muscle increased tension, bracing and pain. I'll give an example. A girl and boy working in the same office, but not talking to each other. The girl entered the lift on 21st floor. The boy just entered. Lift coming down 21 floors. The girl is bracing herself. Will he touch me? Will he not touch me? Will he touch me? Will he not touch me? The boy does nothing. The same thing happens for 15 days. He's done nothing. Even on 15th day, she's ready to fight because she couldn't run in the lift. And 16th day, she goes to the doctor with a stiff neck. And then X-ray normal, MRI normal, 21-year-old. How will you find out stress? This is what happens in stress. When you have muscular pain with no diagnosis, all investigation normal, your muscle relaxants, NSAIDs not working. Smooth muscle increase contraction, urge to urinate, urge to pass stool. Increase perspiration. I'm perspiring too much. Here we know that before exam, if the child perspires, it could be stress. Decreased temperature of the skin. I perspire and I feel cool. And immune system is weak. Doc, lately I'm getting too much of cold. I'm getting hives. And you examine, sinuses are normal. No polyps, no inferior terminates enlarged, no signs of allergy. Stress-related psychosomatic conditions. Hypertension, essential hypertension is a psychosomatic condition. Stroke, coronary artery disease, ulcers, migraine headaches, tension headaches, and maybe cancer also. Allergies, asthma, hay fever, that is in England, rheumatoid arthritis, backache, temporomandibular joint syndrome, because when you are angry, you keep clenching your teeth, and recurrent clenching of teeth leads to temporomandibular joint syndrome. So how do you manage stress? It's a three-legged stool. Diet management. If you are stressful, or if you are going to meet, like, okay, now is the lunch time. Boss has called me post-lunch. I don't know. I'm worried. Will I take a triple Szechuan or will I just take a buttermilk or rice or just limbu pani? Diet which relaxes, diet which causes more problem. Exercise. Exercise burns stress chemicals. Imagine, all of you must have seen movies of Sunny Deol. When he gets angry, he goes to the gym and punches the bag. He's burning his stress products. You shout, you are burning stress products. And lastly, relaxation. You need all three, not one, and all three together. Many techniques bring on relaxation response, and generally one will click with the patient. Exercise aerobic involving whole body, jogging if the health permits, brisk walking, cycling and swimming at least 5 days a week burn stress products. Meditation could be silent. You sit and think. Could be focused, looking at a red light, looking at a rose, looking at something. Prayer, you meditate while doing prayer. You have a beads mala in your hand and you keep counting and you meditate that way. Guided imagery. You know, the best meditation is combined of breathing and imagery. You know, all of us now, you think this, and I'm sure the answer will be yes. With whatever stress we may have in life, with whatever problems we may have in life, there are 5 people, 5 instances that you can remember will always bring a smile on your face, whatever stress you may be in. That gives you meditation, active yoga, meditation with yoga poses, shaking. Some people keep shaking the body and then they meditate. So whatever is comfortable for them. You don't have to sit cross-legged. None of us today above 50 can sit cross-legged. You have to sit in a comfortable position, chair, stool, whatever. Hypnosis, of course, here you have to go to a professional. The above 3 are self-induced, so you're not wasting money or investing money. And there's a condition called mindful-based stress reduction. I'll tell you a bit about that. You can find more details on internet and guide your patients. Autogenics is a self-generated to come from within. Utilizes the power of mind to help calm and relax the body. It involves repeating specific phrases that help create calming sensation and center on different areas of the body. So a Hindu may keep chanting Om, a Muslim may keep chanting Ya Ali or their prayer, and a Sikh may keep chanting Vaheguru Da Khalsa, but then you repeat certain phrases which calm you down. And mindful-based stress reduction, MBSR, 8-week evidence-based program started by University of Massachusetts Medical Center. You can get it on YouTube, internet, and guide your patient to join that. Before I stop, I want to give 2 more points because we have 10 minutes still. I have been always saying that for whatever condition you are treating, hydration and nutrition is of paramount importance. So this patient came to me on Saturday. She had a bad throat, she had a cough, no fever, and we gave her a prescription of 5 days medicine. It was follicular tonsillitis. We gave azithromycin, we gave supporting medication, and we gave on instruction of 2-liter water, fruits, buttermilk, milk, everything. Monday morning, she calls me, says, I'm very weak, doctor. I'm feeling extremely fatigued. So I said, have you been drinking enough water? Have you been eating well? I have been doing everything. So I said, come and see me. On examination, she looked decidedly anemic. Like I had seen her 2 days back, she was normal. And this is a patient of mine who's been with me for 15 years. If she comes to clinic 10 times, it was 9 times to take medicine for her in-laws who cannot walk and 1 time for herself. And Monday, her hemoglobin looked like 6 to 7. And she was kind of breathing heavily, but no rhonchi, no RALs. We immediately did a CBC. And by the evening, we got a shocker. She had acute myeloid leukemia, which was confirmed by a bone marrow transplant, bone marrow aspiration. So any patient unduly weak, despite good nutrition, good hydration, please take seriously. Secondly, one more research study I saw on the internet. We all advise Influvac to our patients who are diabetic, who had pneumonia, who are immunocompromised. But one study done in Israel, over 9,000 patients showed that giving influenza vaccine to patients who have coronary artery disease manifestation They may not have had an attack yet, but if they are CAD, they are on treatment for coronary artery disease. Influvac reduced fatal infarcts by almost 20%. So it's time that we start offering Influvac. Of course, most of us are offering to all patients, but patients with some amount of myocardial ischemia, please start offering Influvac vaccine, influenza vaccine, whichever brand you use. Thank you. See you next week. Self-induced stress is a person-owned desires and expectation more harmful than work-induced environment. Yes. Jealousy, Reni Nainan, what your meaning is jealousy? That is a self-induced. And today, because of social media, that has become very high. Post-CABG stress, yes. Any disease can cause stress. Parkinsonism, post-CABG, post-joint transplant, anything that is going to require behavior adjustment for coping with is going to give a lot of stress. Influvac vaccine, see, CABG, if you're doing no, that means it's an established coronary artery disease. So you have to give. Even after stent implant and all, you have to give. Thank you very much. See you next week.